Hey, Dave O'Sullivan here, and in this video I want to show you how to build confidence for your patients in their bodies. Now, a lot of your patients will come in, if they're anything like mine, and they just want to say, I just want to feel confident again. I want to feel confident picking up the kids. I want to feel confident putting out the rubbish without paying for it later. Now, when we break this down, confidence is quite a big word. But when we actually look at how to build confidence in our patients' bodies, it all has to come back to our graded exposure program. So the first few sessions for a patient, when a patient has pain, they use what we call, or what Louis Gifford in his books on aches and pains would call, a top-down approach, okay? And a top-down approach is where we're thinking consciously about every part of the movement, okay? So we've all had this acute back pain patient, and you can see as they go to touch their toes, they're literally thinking about every single bit of the movement. They're moving cautiously and they're moving consciously, okay? So what usually will happen in the first couple of sessions, we're focusing on more top-down cues, such as using their hands to facilitate movements and get other parts of their bodies doing their job also. Now, where the confidence comes in is the transition. So you can see here the T, which is for top down. That's where then we start to get bottom up, okay? So in real life, even as I'm doing this now and I'm talking to you, I'm moving my hands, okay? But I'm not consciously, until I started to think about it, thinking about where my hands are going, okay? So how we work in the real world on movement, it all starts with an outcome, okay? So if I'm gonna write on this board, I'm going to take my hand and I've brought it to the whiteboard, okay? Now, I wasn't consciously thinking about setting my scapula, my lower traps and moving like that. That's no way to live life. To move confidently and without any apprehension, okay, I need all of the muscles to work independently of conscious control. So the movement is dependent on the outcome that I want to achieve, and then we want that self-organization, okay, where the rest of the body and the spinal cord and the peripheral tissues take care of the rest of the movement, okay? So that's where, in order to get confidence, we have to bridge that gap from a top down to a bottom up. When we get bottom up, we want to expose our patients to situations where there's no time, and this is how I like to do it, where there's no time to consciously think about putting a strategy together. That's where the likes of hops and more dynamic movements in rehab are really, really good to build the confidence. Now, what we're going to need to do here is we're going to need to do a graded exposure. If we just go straight to these exercises, very often from my experience, that the jump is too quick and then the nervous system, it tightens up again, or it gives some kind of negative reaction, okay? Think about if you go into cold water, the first thing you're going to do is you're just going to tighten up, okay? Very often, if we just gradually expose our leg to the water, our leg gets used to it, we desensitize to it, and then we can actually relax into the water, okay? Whereas the very first thing that happens usually if we skip a step is we usually get a negative reaction such as tightening, or that can be a pain experience. So the art in this is to bridge the gap from low to high level rehab. But if you want your patient to feel confident in their body, then the one thing that you can't be doing is getting your patient to be thinking about using muscles, squeezing their glutes, turning our core on, all of that stuff. That for sure may have a place in the early focus, but you need to understand that that's top-down cues, okay? So we're consciously thinking about it. And that might have its place in your graded exposure, but if you want the confidence, you want to build confidence in your patients, you have to expose them to these situations that they're going to go back into, and you have to, just like the water strategy, we have to expose them to the water, get used to the water, and actually allow them to relax in the water. And very, very often, confidence is associated with relaxation. It's not actually associated with contraction. So very often for me, when I put them in these situations, the first few reps that they're going to do with a hop, they're going to look quite rigid, okay? They're going to look quite tense, okay? And you might even see their facial features actually tensing as well, okay? But as they start to build confidence, you'll see that the body will relax into the movements, and that's how you know you're building confidence. And in those situations, there's no time to be thinking about consciously activating muscles. So if you do a good job building through the graded exposure, we should effortlessly arrive at this point if you have a structured step-by-step system. Now, if you want help with this, if you want help structuring your subjective, your objective, and your full treatment plan, as well as having the confidence to actually explain to the patient the problem, solution, and plan, then just drop a yes, please, in the comments below, and I'll send you all the information of the Go-To Physio Mentorship and how we've helped over 850 plus therapists all over the world become the go-to physios in their